So this is really important, guys. Especially for muscle of the leg, because it is something we use every day and day. Like we are all the time we're using our back muscles. So as long as we are upright, these muscles of the back contract, and it has to do the job. So let's start. We talk a little bit about this muscle of the back on Wednesday. So these are the muscles we are going to talk about today, everything we see from the back. And so look at that, this muscle, I believe, this is the trapezius here, trapezius muscle here, and this is the deltoid muscle here. This might be infraspinatus, supraspinatus, and teres minor. And what are these muscles? That's something we need to check out. Hey, look at this fan-shaped muscle. Look at this big muscles at the back. That's the latissimus dorsi muscle. And it is pretty good to see these, striping gluteus maximus muscle and muscles in the back of our thigh, which are called the hamstring muscles, and muscles in the back of the leg, which we call gastrocnemius. So gastrocnemius, hamstring group, gluteus group, and the latissimus dorsi. And let's go and fish out one after another. So there are lots of muscle in the back, like as we saw from the previous photograph. Yeah, we see the big trapezius muscle, which is the triangular muscle, and we have seen the big sheet of muscle, which is more or less triangular, which is called latissimus dorsi muscle, latissimus dorsi, and latissimus dorsi muscle. And in the center, if you look at that, this white sheet, it is called the lumbar fascia, thoracolumbar fascia. So yes, thoracolumbar fascia and the latissimus dorsi, they are in continuity together around the low back of our spine, so this is the muscle, and you can see the gluteus maximus muscle here. This is really good diagram, and especially when we look at that, this is the gluteus maximus muscle here. So let's move on, and this is the cadaver. You can start seeing the latissimus dorsi, and you can see the TLC, thoracolumbar fascia, and gluteus maximus muscle here. And yes, thoracolumbar fascia here and latissimus dorsi on the right. You can see the trapezius. This is the cadaveric presentation. So there are lots and lots of muscles in the back, and therefore, if we are asked what are the muscles in our back, the way we try to remember is, hey, extrinsic muscles and intrinsic muscles. So that's the way we try to remember muscles of the back, extrinsic muscles and intrinsic muscles here. So what do we mean by extrinsic muscle? Extrinsic muscle means those muscles from the back going to the upper limb or the thoracic wall for the respiration. So they are related to movement of the upper limbs and respiration. What are the intrinsic muscles? Intrinsic muscles, they will act on the vertebral column and vertebral column itself. So muscles of the back can be divided into extrinsic muscles and intrinsic muscle. Extrinsic muscles are from the back going to the thorax for the respiration, or from the back going to the arm for the movement of the upper limb muscle. And the intrinsic muscles of the back, they are just the muscle which is acting on the vertebral column. So it is a bit easy to remember if we try to remember in that way, because there are lots and lots of muscles in the back. So we have to play the game. We have to be smart when we are trying to remember these muscles in the back. Yes, as an undergraduate student, you don't really need to know all these muscles. But let's say if somebody say spinalis, that means I want you to know it is from the spine. So spinalis muscle. Multifundus, if somebody say, where is the multifundus? Multifundus is not in the thorax, multifundus is in the spine. So at least, like if you cannot remember all the muscles for the back, at least if you hear the name, I want you to remember where they are. So let's say extrinsic muscles and intrinsic muscle. If we divide the extrinsic muscle again, we will divide into 3 layers, first layer, second layer, and third layer. And for the intrinsic muscle as well, we will divide into first layer, second layer, and third layer. So that's easy, isn't it? So let's start with the extrinsic muscles, which involve for the movement, muscle for the movement of the upper limb and respiration. So the most superficial, number 1 layer is trapezius and latissimus dorsi. That is something we see. So if we remove the skin from a person, we are going to see the trapezius and latissimus dorsi. That is what we saw. So it is not a big deal here. So if we remove the skin, we see the trapezius and latissimus dorsi. So what is the second layer? Levator scapulae and rhomboid major, rhomboid minor. Levator scapulae mean elevate, like lift up the scapula. Levator, elevator, levator scapulae mean which will lift up the scapula. So look at that. Where is the levator scapulae? Here, levator scapulae here. Look at that. It is deeper to the trapezius muscle. And here is, we can see rhomboid major, rhomboid minor, rhomboid major, rhomboid minor, and levator scapulae here. So these are the second layer of the extrinsic muscles of the back. So yes, it is not that bad. And finally, serratus posterior superior, serratus posterior inferior. So yes, we can even see they are pretty deep inside the deep in the back of the muscle. So let's forget about that. So first layer, we can see the trapezius and the latissimus dorsi. If we remove the trapezius and latissimus dorsi, we will see the rhomboid major, rhomboid minor, and levator scapulae. And the number 3 third layer is serratus posterior superior, serratus posterior in the back, and serratus posterior inferior. That's easy, guys. So that is the extrinsic muscle of the back, and these muscles will involve with the respiration or movement of the upper limb. So let's go to the intrinsic muscles of the back. Splenius, erector spinae. I want you to remember as erector spinae rather than iliocostalis, longissimus, and spinalis. So I want you to remember erector spinae. It is the name tell what it is going to do. Erector means it is going to make it erect. Spine. So if this muscle is acting on the spine, this muscle, it will pull up the spine in an erect position, isn't it? Erection, spine erection. Yes, keep the spine straight. So number 2 layer is erector spinae, and number 3 layer is little things, multifundus, semispinalis, rotatories. Okay, do you need to remember all these? No, but as I say, like if you have these names, I want you to relate to the back, multifundus, spinalis, that sort of stuff. Erector spinae, which will make the spine stiff, and the splenius muscle. So let's go and look at these muscles here. So now we can see the trapezius, we can see the trapezius, we can see the latissimus dorsi here, green, and then we can see the second layer, rhomboids major, rhomboids minor, and levator scapulae. And the little splenius. What is the splenius muscle? Splenius muscle is the deep So splenius muscle, this is the splenius muscle here, the first layer, which is what we are going to see here. Splenius capitis and splenius cervicis. So capitis mean to the head, cervicis mean to the neck. So these are the splenius muscle, first layer of the intrinsic muscle of the spine, which means the splenius, capitis or cervicis, it is going to act only on the spine because they are intrinsic muscle. And as I say, I want you to remember as erector spinae. Where is erector spinae? It is here. It is made of iliocostalis, longissimus, and spinalis. Look at that. These are the long, big muscles running in the back of the spine on either side. So yes, iliocostalis, which means it is coming from the ilium, going to the iliocostalis is going to the costal cartilages, isn't it? It's iliocostalis. Longissimus. Longissimus is a long muscle here, and spinalis. Spinalis. Look at that. It is pretty in the center. So that's the second layer, which is the erector spinae, and the yes, it is the showing the splenius capitis and splenius cervicis in the neck. That's the origin and insertion. I would say have a look, but don't worry too much about that. And finally, the deepest layer, number 3 layer of the intrinsic muscle is the multifundus. Look at the multifundus here, from the transverse process going to the spinous process and rotatories that will rotate the muscle, and intertransverse series in between the transverse processes. So these are the deepest number 3 layer of the spine. Don't worry about the origin and insertion of these muscle. If you have a look, if you have a chance, have a look. It is interesting, but it will not be in the exam. So in general, muscle of the back can be divided into extrinsic muscles and intrinsic muscle. Intrinsic muscle, we act on the vertebral column, and extrinsic muscle, we go from the spine, go to the upper limb for the movement, or the thoracic wall for the respiration. And these are the muscles we talk about. Right, so that is pretty short about the muscles of the back. And I am going to stop the screen share and let me go to the next slide, and next, which is the main portion, which is the muscles of the lower limb. Yeah. All right, guys. So we will talk about muscles of the lower limb. I believe everyone can see. So yes, muscles of the lower limb. It is a big group. There are a lot of muscles, like muscles in our arm, So it is like, I just want you to sit down, relax, and then just try to follow as much as you can. Try to follow as much as you can. And so muscles in the lower limb, we will talk about the gluteal muscle. Gluteal muscles mean muscles of the buttock, and muscles in the thigh, and the leg muscle, and the foot muscle. So yes, we will divide the lower limb into gluteal region, thigh, femoral region, leg, tibiofibular region, and the foot, the plantar muscles. So, hey, look at that. This is somebody's buttock. This is somebody's buttock. There are a few little terminologies which we need to pick up from this photograph. If we, in between two buttocks, it is called nadir cleft. Yeah, nadir cleft. So these are the terminology. And this is what we call gluteal fold. Yeah, gluteal fold, nadir cleft. And here we have been talking about ischial tuberosity. Ischial tuberosity means if you are sitting now, you are sitting on the ischial tuberosity, which is the bony band from the pelvis. If we can easily poke ourselves, and we will be able to feel the bone here. Ischial tuberosity region, and this muscle, our buttock muscle, is made of gluteus maximus on the most superficial or outermost region. And you can see the hollow posterior to the greater trochanter. So look at anybody's buttock, you will see the little hollow, little dimple on either side here and here. It is related to the greater trochanter region. And you can see the dimple for the posterior superior iliac spine. So you will be able to see that if you have a little baby, have a look here just around and lower end of the spine, you will see the dimple here. And if you follow the iliac crest, here is the uppermost superior point of the iliac crest. So these are the anatomical landmarks which we should remember. I have to say gluteal fold, nadir cleft, dimple posterior to the greater trochanter, dimple like for the posterior superior iliac spine, and this is the highest point of the iliac crest. Okay, so I will move on to next slide. This is right side. Intergluteal cleft, that's okay. Yeah, so now I have removed the skin on the right side of this patient's buttock. And I am looking at the muscle here. Look at the gluteus maximus muscle here, which is the most superficial, muscles in the back. Yeah. So if we remove the skin and fat from the buttock, that is what we are going to see. And this is the sciatic nerve, which is really important for the leg and the lower limb, which is just running around here, close to the nadir cleft. And here they have shown you where to do the injection, intramuscular injection here. And you can see the iliac crest here, iliac crest. And this is the posterior superior iliac spine, which we saw here, the dimple for the posterior superior iliac spine. And this is the site for the injection. So if you have to do an injection on somebody, let's say if nobody's around, and if you are going to do the intramuscular injection on a person, what I want you to do is I want you to divide the buttock into 4 quadrants, and you choose the upper and outer quadrant. That is the safest part of the gluteal region for injection, because there is no muscle, no major nerve or blood vessels here. So like if you choose the inferior inner quadrant, so this quadrant, there may be a tendency to hit the sciatic nerve. sciatic nerve injury is a big thing, so we want to avoid that. And therefore, we choose the upper outer quadrant. That's for the intramuscular injection. So that is a good thing, good knowledge to understand why we do intramuscular injection in the buttock on the upper outer quadrant. Okay, this is somebody's buttock. Keep looking at buttocks. Yeah, so now if we remove everything, what is, that's the beauty, but this is just a skeleton, isn't it? So I want you to, if you look at somebody's buttock like that, I want you to see through the skin and the muscles underneath. And hey, this is what we have inside. This is what we have inside. This is what we have inside, yeah? So this is the bony skeleton of the buttock. Just going to show you again. Look at that, and that's it. So now we can see the patient is in the anatomical position. The patient is in the anatomical position, and it is we who is standing to the posterior and lateral aspect of the right side of the patient. And we can see the ilium, which is here. This is the iliac crest. This is the anterior superior iliac spine, iliac notch, anterior inferior iliac spine, anterior superior iliac spine. If you can easily feel it on yourself. And if you follow the anterior superior iliac spine, if you follow along the iliac crest, you might be able to feel the posterior superior iliac spine here. It is a little bit difficult. I think there is no way we can feel the posterior superior iliac spine. And this is the ischial tuberosity, which is somewhere we sit on top. Yeah, which is somewhere we sit on top, ischial tuberosity. Now we can see the greater trochanter here, and we can see the lesser trochanter on the medial side. So I hope you guys remember this diagram. We have been talking about this. We have been talking about this diagram all the time, like starting from the early stage. Ilium, ischium tuberosity. This is the ischial spine. This is the ischial spine, and this is a big notch. That is what we call greater sciatic notch. Okay, do not go there. And the ischial tuberosity, it is somewhere we sit on, and the greater trochanter and lesser trochanter. Okay, so bang. Now I am going to put all the muscles back except the skin. So I have removed the skin. I have kept all the muscles in the buttock. And this is what we are going to see. Now we can see the gluteus maximus muscle, which is big and fleshy muscle here, which is really a big, strong muscle, gluteus medius and maximus. And underneath, we will see the gluteus medius muscle here. So gluteus maximus muscle is the most superficial muscle, which is just underneath the skin and fat. So if we remove the gluteus maximus here, we will see the gluteus medius muscle here, which is something we see partly because it is partly covered with the gluteus maximus. So if we remove the gluteus maximus, we will see the gluteus medius muscle here. And of course, we can see a few little other muscles lower to the gluteus medius. And now I'm going to remove the gluteus medius muscle. Bang. Oh, if I remove the gluteus medius muscle, I am seeing the gluteus minimus muscle now. So now you have seen a different layer. The most superficial layer is gluteus maximus, big gluteus muscle. Underneath, we will see the gluteus medius muscle. And underneath the gluteus medius, we will see the gluteus minimus, small gluteus minimus muscle here. So that is pretty cool stuff and easy to remember. Gluteus maximus medius in the middle and the minimus in the small little minimus minimum at the deepest part of the gluteal region. And now I can see a muscle which is like a quadrant shape, which therefore I would name it quadratus femoris. Of course, it is going into the femur, and therefore I would say quadratus femoris muscle here. So which is pretty low down here, This is the greater trochanter, so it is going and attached to the greater trochanter posterior surface. So now you have seen gluteus maximus, you are seeing gluteus maximus, you are seeing gluteus medius, and you have seen the gluteus minimus. And at the bottom, just posterior to the gluteus maximus, posterior to the greater trochanter is quadrant-shaped muscle, which is called quadratus femoris. So gluteal muscle, which is made of gluteus maximus, gluteus medius, and gluteus minimus. The nerve supplying the gluteus muscles are really, really important because they can get damaged with the hip surgery. They can get damaged with the inappropriate injection site for the intramuscular injection in the bed dog. So for the sake of everything, for the sake of anatomy, for the sake of clinical implication, we have to remember these nerves. Again, it is easy to remember. There are only two nerves for the gluteal muscle, superior gluteal nerve and inferior gluteal nerve. Hey, gluteus maximus is outsidemost. You might think gluteus maximus is supplied by the superior gluteal nerve. No, just try to remember other way around. Gluteus maximus is supplied by the inferior gluteal nerve, and gluteus medius and minimus is supplied by the superior gluteal nerve. The job of the gluteus maximus, because it is really, really back at the back dog, really posterior to the body. So if that gluteus maximus contract, the hip will be pulled to backward, which is called hip extension. The hip, the leg is going backwards, which is called hip extension. And yes, to some extent, it is important for the hip abduction, meaning going away from the body. Gluteus medius and minimus, which is supplied by the superior gluteal nerve, it is for hip abduction. So pulling the hip outwards and so that is, when we walk, when we mobilize, then the hip abduction became important, and therefore gluteus medius and minimus became important, and these are supplied by the superior gluteal nerve. So gluteus maximus extend the hip, gluteus medius and minimus abduct the hip. So that is the important function which we have to remember. Okay, let's look at that. So the outermost layer in the gluteal region is gluteus maximus muscle. Now I have get the gluteus maximus muscle to see the muscles underneath. So if I get the gluteus maximus, I will see the gluteus medius muscle, And underneath the gluteus medius, I will see the gluteus minimus muscle. And you can see a little muscle here, just inferior to the gluteus minimus is piriformis. Yet piriformis, like it is like a big thick muscle, not very broad, and finally became like a very strong, tight taut tendon. Look at this tendon here. In real life, it is really beautiful, pearly white and pristine tendon, which is coming from the small little solid muscle. It can attach to the tip of the greater trochanter. And we have seen the quadrangular shaped muscle, which is called the quadratus femoris. And in between these two, piriformis and quadratus femoris, we have superior gemelli, inferior gemelli, and in between obturator internus. Internus in between obturator internus. So hey, these muscles, a lot of names you are going to remember, and I appreciate that. But that's why, you know, when you are sitting in the lecture, just try to absorb as much as you can. Like, just try to follow it. So gluteus maximus, gluteus medius, gluteus minimus, quadratus femoris, and piriformis, superior and inferior gemelli, and obturator internus. So that is really cool to know somebody's hip anatomy. Okay, so let's move on to next slide. This is the cadaver. This is the cadaver, and now we have seen the gluteus maximus, we have seen the gluteus medius, and gluteus minimus, which is going to be underneath the gluteus medius, and now we can see the sciatic nerve. So you can now appreciate the proximity of the sciatic nerve and where we are going to inject. And therefore, if you need to do injection intramuscular in the buttock, choose the upper outer quadrant. Yeah. Okay, let's move on. So this is, again, I keep showing you again and again. This is the sacrum. This is the posterior aspect of the right gluteus and the thigh. And you can start seeing the gluteus maximus has been removed. You can see the piriformis muscle here. And this piriformis muscle, here you can see the yellow big structure coming out underneath the piriformis and running down in the posterior aspect, of the thigh. Look at this yellow structure. That is what we call the sciatic nerve. Now you can see the course, like the way it is going. You can see the course of the sciatic nerve here in the middle of the thigh and coming out from the sacral region, and it is running underneath the piriformis. So this is the sciatic nerve. Okay. So again, like I keep showing you again and again, gluteus maximus, gluteus medius, gluteus minimus, piriformis with the very nice and clean and beautiful white tendon, piriformis, come and attach to the tip of the greater trochanter. And here underneath the quadrangular muscle, which is what we call quadratus femoris. And we have seen the superior and inferior gemelli with the obturator internus muscle in between. Okay, let's move on. So these are the origin and insertion. The piriformis muscle originate from the sacrum, and it is going to attach to the superior border of the greater trochanter. Obturator externus, don't worry about that. So piriformis insertion, a little bit important, superior border of the greater trochanter of the femur. Origin, it came from the sacrum. As long as you remember sacrum, I'm happy with. Okay, so now let's move on to the next slide. So this is the just for the completion, like, you know, it is for the origin and insertion, which will not be in the exam, Yes, Kirsten.
I don't know if it's completely relevant, but what causes sciatica?
Sciatica, it is, let me go to this now. Sciatica means the pain going along the sciatic nerve. That is what we call sciatica. So yes, sciatica, the pain can be coming from the sciatic nerve, which is like, if you look at the sciatic nerve, it is coming from the sacrum, or the S1, 2, 3, 4, like these are the origin of the sciatic nerve. So there might be disc prolapse pressing on the nerve, and then the pain, because it is pressing on the nerve, and the nerve pain is running along the distribution. Like if it is coming from the lumbar 5, then nerve root, lumbar 5 nerve root will be running along here, and it is going down here. So that is what we call sciatica. So it is just the pain along the sciatic nerve.
Okay, I wasn't sure if it was like because of tight muscles or.
It can be because of the tight muscle, because sometimes, you know, you can see this little piriformis muscle here. So some people, they have a little bit bigger piriformis, and it can squash the sciatic nerve.
Oh.
So yeah, so like this sciatic, that is what we call piriformis syndrome, you know, like the patient present with the pain in the back of the thigh. So the pain in the back of the thigh along the sciatic nerve is called sciatica. So it is the, let's say, patient's complaint. It is not their real diagnosis. So if somebody has got sciatica, we need to check the sciatic nerve. Of course, its origin, like lumbar 4, 5, sacrum 1, 2, 3, 4 region, and as well as the muscles. So the tight piriformis muscle can give us the sciatica type pain. But usually, you know, when we say sciatica, means we refer to the degenerative disc in the back, and then that disc prolapse, and the disc is irritating on the nerve root for the sciatic nerve.
Okay, thank you.
Okay, that's good. That's sciatica. Yeah, sciatica is important. We need to talk about that. So yeah, means this piriformis muscle can compress the sciatic nerve here, somewhere around there. And then, you know, that is a difficult diagnosis. Like it is difficult to identify the cause, because usually sciatica, if it is too long, we do MRI scan for the back, and we can see the problem. If it is normal MRI scan for the back, then we have to think about all these, the cause, the route of the sciatic nerve, and then we have to check one after another for the possible causes. So look at that. This is again, like they look at the sciatic nerve here, sciatic nerve, which is just coming underneath the piriformis muscle. Piriformis muscle is coming from the sacrum, going to the tip of the greater trochanter here. And you can see the gluteus maximus muscle, which has been cut away. And you can see the gluteus medius muscle. And underneath, we will see gluteus minimus muscle. And that is very beautiful. Look at that. Sciatic nerve is coming just underneath the piriformis. And piriformis can compress on the sciatic nerve and pain along the posterior aspect. And that way present as sciatica. Sciatica means pain in the back along the sciatic nerve. So now you have seen this diagram again and again already. And the pelvic bone is made of ilium, pubic, superior pubic rami, inferior pubic rami, and you have seen the ischial tuberosity and ischium. So combination of pubic rami, ischium, and ilium, that's the pelvic bone, and together with the sacrum, it forms the pelvic girdle. Yeah, pelvic girdle is made of the right pelvic bone, left pelvic bone, and the combination of sacrum, and they meet in the center. And you have seen this greater trochanter, lesser trochanter. Lesser trochanter is really, really deep, close to your groin, which means lesser trochanter is very difficult to feel. And the femur, and the neck of the femur, you can see the neck of the femur, and you can see the head of the femur. Of course, you know the anterior superior iliac spine, which is easily palpable on your body, and you can trace the anterior inferior iliac spine, which is very difficult to feel on our own body. And then if you follow the anterior superior iliac spine, go backwards, that is what we call iliac crest. And here you will see the posterior superior iliac spine. And this is what we call the joint between the sacrum and the ilium is called sacroiliac joint. So this pelvic anatomy, you have seen this again and again. I hope you remember all these. So if you know this anatomy, and this is easy for you, yeah, this is easy for you. This is the neck of the femur. This is the head of the femur. This is the greater trochanter. This is the lesser trochanter, which is here. This is the anterior, this is the superior pubic rami, and this is the inferior pubic rami. What's the big deal? This is the ilium, and you can see the sacroiliac joint here. This is the sacrum, and this is the pelvic cavity. Okay. So I just want to ask you guys whether this X-ray is a male pelvis or female pelvis.
I would guess that that's a female.
That's a female pelvis. That is correct. Why do you say that?
Because is it called the inlet is very round?
Yeah,
wide.
perfect. Yeah, so like, you know, this is a very, very wide pelvic canal, which is like a, you know, very big, very wide. So that's for the baby to come out. That's why this is female pelvis. And this triangle, isn't it? This is very broad as well. In the male, I would say this. In the female, I would say this, because that's the pelvic outlet. This is the pelvic inlet. Inlet is wide, pelvic outlet is wide, and therefore this is female pelvis. Very good, thank you. So yes, this is the female pelvis. Okay. Oh, look at that. So now we are, so this skeleton and this X-ray has led us to this diagram. We are now putting back all the muscles. We have, you know, we have seen the bone, underlying bony structure, and on top of that, we are putting all the muscles back here. So I will start with the quadratus lumborum. Look at that, quadratus lumborum. You saw the quadratus femoris. Of course, it is in the quadratus, it is the quadrangular structure. Yeah, quadrangular structure, therefore it is called quadratus. If it is in the femur, it is called quadratus femoris. And if it is in the back lumbar region, you have to call it quadratus lumborum. Look at that little quadrangular shaped muscle. It is coming from the 12th rib, guys. So your pelvis and your ribs are connected. So it is amazing, isn't it? Like the way the back muscles are connected to the arms and the pelvic muscles are connected to the ribs. Look at that, quadratus femoris. That is naughty. And you can see this psoas muscle, P-S-O-A-S, psoas muscle. Look at the psoas muscle here. Psoas has two muscles, psoas major and psoas minor. Of course, minor is small, major is big. Don't worry about that. Forget about psoas major, psoas minor. Let's say psoas muscle is originating from the transverse processes of the lumbar 1, 2, 3, 4, 5. 5 lumbar vertebra, 4th lumbar vertebra, 3rd lumbar vertebra, 2nd lumbar vertebra, and 1st lumbar vertebra. From the tip of the transverse processes, they originate. Might be 12th thoracic vertebra as well. It's not always for the 12th thoracic vertebra, but they might be. But usually lumbar 1 to lumbar 5 vertebra, this psoas muscle, psoas minor, psoas major, it is from the back and it is coming just into the pelvis. And look at that. And on the inner surface of the ilium, look at the ilium, you have seen on the inner surface of the ilium, we have the iliacus muscle. So iliacus muscle is somewhere around here, inner surface of the ilium. So inner surface of the muscle, we have the ilium. And you have the psoas muscle, which is originating from the tip of the transverse processes of the 1, 2, 3, 4, 5 lumbar with or without 12. And combination of these two is called iliopsoas muscle. Iliopsoas. You know iliopsoas. Iliopsoas muscle. Iliopsoas muscle will be originating into the lesser trochanter, guys. Yeah, so the psoas muscle from the tip of the transverse processes and the iliacus muscle from the ilium, they will become combined tendon, which is called iliopsoas tendon. Iliopsoas tendon will come and attach to the lesser trochanter. Iliopsoas tendon will come and attach to the lesser trochanter. So look at this iliacus and psoas combination, iliopsoas, psoas, we're going to attach to the lesser trochanter. And you can see a muscle which is called sartorius. Sartorius running from the tip of the anterior superior iliac spine, going across the thigh from the lateral going towards the medial. Okay, I have talked too much about these muscles again and again. These are the origins and insertion. May just have a look just for the completeness. Don't worry too much about this. And look at this here. Sartorius is all shaky here. It's originating from the anterior superior iliac spine, running across the front of our thigh, going to the medial aspect of the knee. Look at that, how crazy it is. And you can see the iliopsoas tendon here. And there is the pectineus muscle, which is what we saw here, pectineus muscle. And now you can see the adductor, so adduction, pulling the hip towards the center, meaning squeezing your legs together, adduction of the thigh, adductor. Adductor has 3 adductors, adductus longus, adductor magnus, and adductor brevis. Brevis we cannot see yet, but we can see the adductor longus and adductor magnus here. So adduction means squeezing the thigh together, pulling your legs together. That is the adduction. So this adduction, like adductor longus, adductor magnus, and adductor brevis tendon, together with the gracilis, Grace. So you remember Grace, who is one of our friends, yeah, Grace here, Grace and the adductor will become the adductor tendon, and which will come to around the pubic bone, which is easy to feel on yourself. So if you pull your leg back towards the center, like if you spread your legs and push your knee to the medial aspect of the knee, and you pull your legs, inwards, and with your other hand, you can feel the inner aspect in the groin, and that is where you are going to feel the adductor tendon. So now you have seen the sartorius, which is coming from lateral to medial, ASIS to the medial aspect of the knee. You have seen the adductor longus, adductor magnus, and I hope you will be able to find your adductor tendon, which is around the groin, which is very easy to feel it. And now you can see the very front muscle, which is the quadriceps femoris muscle. Quadriceps, quadri means four, isn't it? Quadrant means four. Quadriceps femoris, which is made of rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius, which is underneath the quadriceps femoris. So combination of three vastus and rectus, rectus means straight. Three vastus and rectus muscle called quadriceps, four muscle, quadriceps. And now you have seen the quadriceps muscle here. Okay, so I hope it is quite a lot of muscle. So I'm going to give you a break. So it is not 11 o'clock yet. So let's take a 15 minutes break, and we will meet let's say 11:05. Yeah, so 11:05 we will meet. And before you go, yes, try to remember this. When you come back, we will start from this slide. So 15 minutes break, guys. 15 minutes break. It is 10:53. So 10 minutes to 11 and 5 minutes. So 11:05 we will meet. Yep. Too many muscles. Okay, guys, it's 11, so let's start again. Sit tight, sit tight. The semester is nearly over. October is finished. So, like, the game is going to be over, and just sit tight and just push yourself. Right, so let's start. So we were talking about the bony anatomy of the pelvic girdle. Pelvic girdle is made of pelvic bone, which is made of ilium, ischium, and pubic, and the combination with two right and left pelvic bone together, pelvis with the sacrum, it is called the pelvic girdle. Yeah, so this is the right and left sacroiliac joint, the joint between the sacrum and the ilium, sacroiliac joint. Sacroiliac joint will become important as you go more and more like physical therapy or like, yeah, especially if you start doing physical therapy, then sacroiliac joint become important. And this is the bony anatomy, and you can see the plane radiograph. If we take an X-ray, then this is what we will see. But if we put the muscles here, we will see this diagram. So as I try to say, this ilium inner surface is filled with the iliacus muscle. We have the psoas muscle, PSOAS, psoas. Psoas has psoas major and psoas minor. Just forget about that. But just try to remember psoas originate from the tips of the lumbar 1, 2, 3, 4, 5. Tips for the transverse processes of the lumbar vertebra 1 to 5, might be 12. That's the origin of the psoas muscle. And finally, psoas and iliacus bind together, become the iliopsoas, and finally that become tendon, and that iliopsoas tendon is go and attach to the lesser trochanter. Yeah, lesser iliopsoas tendon will go and attach to the lesser trochanter. So you can see the sartorius from the anterior superior iliac spine, crossing the medial. And you remember the quadratus lumborum, quadrangular muscle in the lumbar region, quadratus lumborum. And it is originating from the 12th rib. And you can see the pectineus, adductor longus, adductor magnus. And there will be adductor brevis, but combination of all the adductors will come attached to the pubic bone. And this adductor tendon is so easy to see. Yeah, adductor tendon is so easy to see. Origin and insertion, have a little look. And this is the sartorius muscle coming from the anterior superior iliac spine, crossing the front of the thigh and becoming the medial structure. And that split the adductor group and the quadriceps group. Adductor longus, adductor magnus, and adductor brevis will be underneath here. This is the innermost muscle of the medial aspect of the thigh, which is called gracilis. Gracilis muscle, together with the adductor tendon, we go into the pubis, and it is a tendon you can easily see or you can easily feel in your groin. Yeah. So that is the medial aspect. On the outer surface, we have the quadratus femoris, made of the vastus medialis, vastus lateralis, and vastus intermedius, which will be underneath the rectus muscle. Rectus means straight. You have seen the rectus abdominis. You have seen the rectum. So now you are seeing the rectus, which is in the femur. So rectus femoris. So rectus femoris and 3 vasti muscle makes the 4 muscle group, which is called quadratus femoris. Of course, these all 4 muscle finally became the quadriceps tendon, which is called tendon of the quadriceps femoris. That is what we call quadriceps tendon. And they will come and swallow the patella. They will come and swallow the patella. Hey, look at that. That's the big fat muscle in front of our thigh. And I believe you will easily appreciate it if you see these muscles. So of course, here, this is the cadaveric diagram. I mean, what is the big difference between this and the previous one? Everything is the same, isn't it? Everything is the same. So now we can see, if you do not know, start with the sartorius, which is the long muscle originating from the anterior superior iliac spine, crossing the thigh, and then becoming the medial structure. And then on the medial aspect, we have the adductor longus, adductor magnus, and there will be adductor brevis and pectineus here, and the gracilis muscle here, most medial aspect. And on the other side, we have the rectus femoris and vastus medialis, vastus lateralis, and rectus muscle. Underneath, we will see the vastus intermedius, combination of all these 3 vasti and the rectus. We call it quadriceps muscle. And this is what I'm going to show you, vastus intermedius. So it is the vastus lateralis, vastus medialis, and in the center, we see the vastus intermedius, which is covered with the rectus muscle in the center. So that is the quadriceps muscle of the thigh, which will combination to become the quadriceps tendon. And then we come and swallow the patella, which is the kneecap, and finally continue as the patellar ligament, and we go and attach to the tibia tuberosity. So that is the muscles in the anterior aspect and medial aspect of our thigh. So if you want to remember one muscle in front of the thigh, that is the quadriceps muscle. If you can remember one more muscle, please remember the sartorius muscle. And medial aspect of the thigh, you will know adduction, mean moving the legs to the center, so closing the leg. And this is the arrangement: rectus, vastus medialis, vastus lateralis, and come attached to the patella, and patella become patellar ligament. Hey, here's a guy. There is another site for the injection, lateral aspect of our thigh. Because we only have the vastus lateralis muscle here, vastus lateralis muscle. So therefore, this lateral aspect, there is no major blood vessels or the nerve on the lateral aspect of our thigh. And therefore, it is really safe to do injection, intramuscular injection on the lateral aspect of the thigh. Of course, it needs to be intramuscular injection. So it is, you are injecting into the vastus lateralis muscle. So now with the sartorius muscle here, coming from the anterior superior iliac spine, crossing the thigh from lateral to medial and becoming the medial structure, and it will come and attach to the tibia, close to the tibia tuberosity. Yeah, so that is the sartorius muscle. Look at the way it runs. Yeah, from lateral coming to the medial, from the medial aspect of the knee, and we come and attach to the medial aspect of the proximal tibia. And you saw the pectineus muscle here, and you can see the adductor longus and adductor magnus muscle here. And this is our friend inguinal ligament. I hope you remember inguinal ligament. So the boundary inguinal ligament, adductor longus, and sartorius, we create a little triangle. This triangle is called femoral triangle. So look at it. Now you have seen the femoral triangle. Yeah. So the femoral triangle will be important because the people tend to get femoral hernia. You will be able to palpate the femoral pulsation, femoral nerve, femoral vein, which are all important structures for our clinical practice. And therefore, this femoral triangle became important. So this is the femoral triangle. And this is the injection site in the vastus lateralis for the intramuscular injection. Okay. So now I want you to remember this car, Duchenne, Mercedes-Benz sign. Yeah, triangle. Why it is important? Yes, that's the thigh muscle here. So this is the cross section of the thigh. Let's say this is the Mercedes-Benz sign. And we will translate this sign into slightly different. So this is the femur itself. And we are pushing all these muscles here and there, three. That is we are just trying to misshape the Mercedes signs. That is the compartments of the thigh. Yeah, so now you can see the Mercedes-Benz sign gradually become dividing structures of the thigh. So this is the right thigh. This is the femur in the center. And now we will divide the compartment of the thigh into the three components: anterolateral compartment, medial compartment, and posterior compartment. So that's why I say, if you don't know what to say in the anatomy, just say three. So how many compartments in the leg? We have three compartments. How many intercostal muscle? We have three intercostal muscle. How many abdominal wall muscle? We have three abdominal wall muscle. How many layers in the arteries? We have three 3 layers. So now how many compartments? Compartments in the leg, we have 3 compartments. Like this is the femur, this is the cross section, this is distal, this is, we are doing a cross section, this is lateral, this is medial, and now we have the femur in the center, and we will divide the compartments of the femur into 3 compartments: lateral compartment, medial compartment, and posterior compartment. Of course, lateral means anterior as well as the lateral. So now we will see the cross section here. This is the posterior, this is the anterior, and you can see the posterior compartment, you can see the medial compartment, and you can see the lateral, anterior lateral, anterolateral compartment. Of course, what do we expect in the anterolateral compartment? The muscles we know are in anterolateral compartment, which is the quadricep muscle, isn't it? Quadricep muscle is in the anterolateral compartment, together with the sartorius. Hey, we have seen the medial compartment muscle, which is the adductor muscle group, adductor longus, adductor magnus, and adductor brevis, which we will see. And the most medial muscle is gracilis. And we need to talk about the posterior compartment muscles, which are made of semimembranosus, semitendinosus, and bicep femoris. We have biceps in our arm, which we call bicep brachii. We have biceps in our leg, which we call the bicep femoris. Okay, that's quite a lot. So I'm going back here. So let's do this is the anterior muscle of the thigh, which we have seen. And to keep the muscle in group, we will divide the thigh muscle into 3 groups, which are anterolateral compartment, medial compartment, and posterior compartment. Yeah, anterolateral compartment, medial compartment, and posterolateral compartment. So anterolateral compartment muscles, they are the quadricep muscle, quadri, 4 means rectus and vastus. Vastus lateralis, vastus medialis, and vastus intermedius muscle. They are in the anterolateral compartment together with the sartorius. Yeah. So medial compartment muscle, which we have seen, like adductor longus, adductor magnus, and adductor brevis will be somewhere there, and together with the most medial muscle, which is called the gracilis. And posterior muscle, which is in the back of our thigh, which will be so half membranosus, semitendinosus, and biceps femoris. So 3 muscles in the posterior compartment. So now I have confused you with quite a lot of muscle here, but you know, if we make it in a group, it is not bad, isn't it? The whole thigh, if you cut across, and you only have to remember anterior compartment muscle, medial compartment muscle, and posterior compartment muscle. Posterior compartment muscle, everyone knows, hey, it's hamstring tight. Everyone knows that. The anterolateral compartment, vastus and rectus, quadricep, we know that medial compartment muscle, it is going to close our legs together, which is the adduction, and therefore it is the adductor muscle together with the gracilis. So muscle of the thigh, anterior and lateral, the rectus and vastus, medial, adductor, longus, magnus, and brevis, and I'm missing the gracilis muscle. Posterior muscle are hamstring muscle, which we call semitendinosus, semimembranosus, and bicep muscle. So look at that. This is the muscle of the thigh. the cross section here. This is the femur here in the center. This is the lateral, this is the medial, and you can divide into 3 groups. Posterior compartment, which is the hamstring, lateral compartment, which is made of vastus and quadriceps, and the sartorius, where is sartorius, which we cannot see, and the medial group, which is made of the adductor and gracilis. So these are the muscles of the cross section of the thigh. Yeah. So look at that. That is showing the femoral triangle. You can see the sartorius muscle, which is originating from the anterior superior iliac spine, crossing the thigh, and then gradually becoming the medial structure, and go to the medial aspect, and we go close to the tibial tuberosity, and we attach here. And you can see the quadricep muscle, which is in front of the muscle, which is made of the rectus femoris, vastus lateralis, vastus medialis, and underneath vastus intermedius combination, which we call quadricep femoris. And you can see the adductor muscle, adductor longus, adductor magnus, and adductor brevis, together with the gracilis, which contributes the medial compartment of the thigh. So this is no longer difficult for you, I hope. And this is the vastus muscle, just a reminder, just in front of the femur, vastus lateralis, vastus medialis, and vastus intermedius muscle. Vastus intermedius muscle is underneath the rectus femoris muscle. Okay, so now if I show you this, I believe you will be easy for you. This is the quadricep, this is the vastus lateralis, and this is the sartorius. Isn't it? It's easy now. Everything become easy. So these are the origin and insertion. Don't worry about the origin and insertion, but the importance is all the muscle in front of the thigh, they are supplied by the quadriceps. Yeah, quadriceps is supplied by the femoral nerve. Femoral nerve, femoral nerve, femoral nerve, femoral nerve. Vastus intermedius, medialis, lateralis, and rectus, they are all supplied by the femoral nerve. So because femoral nerve is in the anterior compartment, and therefore femoral nerve will give supply to these muscles. Hey, it is easy. It is all easy now. And sartorius, even the sartorius in the anterior and lateral compartment together with the quadricep, and therefore sartorius is supplied by the femoral nerve as well. Now we need to study the posterior aspect of the thigh and the posterior compartment. There are only 3 muscles to remember in the posterior compartment of the leg. So there are only 3 muscles to remember, as you saw, like semimembranosus, semitendinosus, and bicep femoris. Look at the muscles here, guys. Hamstring muscle, semimembranosus, semitendinosus, and bicep muscle. These are in combination we call the hamstring muscle, and they originate from the ischial tuberosity. Ischial tuberosity is something you are sitting on now. So therefore, if you are sitting on the ischial tuberosity, you are sitting on the origins of the hamstring muscle, which are bicep, semimembranosus, and semitendinosus muscle. Now look at the ischial tuberosity. Ischial tuberosity is this bony bump here, which we sit on, and that gives this bony side give origin to the hamstring muscle, which is made of biceps and semi-T and semi-M. Yeah. So this is the ischial tuberosity. And this is the ischial tuberosity from the side and from the back. Now, I believe you remember ischial tuberosity. And this is the ischial tuberosity. This is the ischial spine. Yeah, this is the ischial spine because it's pointing. This is a bony bump. Therefore, we call it ischial tuberosity. This is the ischial spine, and this is a big notch here. That is what we call sciatic notch. And this is the anterior superior iliac spine. This is the anterior inferior iliac spine. This ilium, the whole ilium, this is what we call iliac crest. And this is the posterior superior iliac spine. And this is the posterior inferior iliac spine. So that's the bony anatomy. Of course, now we can see the posterior aspect. Gluteus maximus is there, and the semi-membranosus and semi-tendinosus here on the medius aspect of the back, and bicep on the lateral aspect here. And don't forget, we have a muscle called, we have a fascia which is called fascia lata. Here, the gluteus muscle can attach to the fascia lata. So now it is becoming a little bit confusing now. Hey, look at that. This is the bicep on the one of the hamstring, which is on the lateral aspect. This is the semi-membranosus and semi-tendinosus. Look at the which is membranosus and which is tendinosus. You can see this here, which is more like a tendon-like. And you can see the sciatic nerve leaving the triangle here. So semi-membranosus, semi-tendinosus, these are the functions which, you know, I hope you will appreciate. It is originating from the ischial tuberosity, which is crossing the back of the knee and which will come attached to the upper surface of the medial aspect of the tibia. So the job is to flex the knee, yeah? So the hamstring is to flex the knee. So as I say here, muscle of the back of the thigh, and muscle of the thigh, anterolateral, rectus, vastus, and sartorius, medial, adductor longus, magnus brevis, and gracilis, posterior, hamstring, semi-membranosus, semi-tendinosus, and biceps. These are the origins and insertion. As I say, it is not really important to remember at this stage. I just want you to concentrate on the names and the muscles. So these are the adductor groups: adductor longus, adductor magnus, and adductor brevis. Where is adductor brevis? Oh, here, adductor brevis, little brevis here, which is hiding underneath the pectineus muscle. We have to remove the pectineus to see the adductor brevis muscle. Hamstring muscle, now you can see on the surface, like on the back, you are seeing the biceps on the lateral side and semi-tendinosus and semi-membranosus. Membranosus is more medial, tendinosus is more lateral. And now you can start seeing the popliteal fossa. Right. So I think I better stop here. The reason is there are too many names of the muscle. And like the more we go, like the more you might get confusing. And therefore, I'm going to stop and we will continue this lecture on Monday. So that's what we will do. But before I let you go, can I remind you from the very beginning? So just try to summarize the muscles of the lower limb. We will be talking about the gluteal muscle, so the muscles in our buttock, and muscles in the thigh, which we were just talking about. And on Monday, we will continue with muscles in the leg and muscles in the foot. So I hope Monday we will finish these muscles of the lower limb easily. And when we talk about the gluteal muscle, before we talk about that, we will have to look at the surface anatomy. As an anatomist, as a medical practitioner, like either nursing or doctor or physical therapist, or like, you know, the wound care nurse, you will have to know this surface anatomy. And in the groove in between two buttocks is called nadir cleft. The lower portion of the buttock is called gluteal fold. So that is the way, you know, we have to communicate with other healthcare professionals. Otherwise, you know, we won't be able to understand each other. Gluteal fold, nadir cleft. This is the hollow or dimple in the posterior aspect of the greater trochanter. This is the hollow or the dimple in the posterior superior iliac spine, and this is the highest point of the iliac crest. So this is not a big deal for you guys. And you can see the pectoral muscle, which is the outermost, is the gluteus maximus muscle. Now I am going to remove the skin and the fat together in the buttock, and this is what I am going to see. Yeah, so if I remove the skin and fat, I will see the gluteus maximus muscle. I want you to appreciate the sciatic nerve, which is quite in the quadrant, and therefore, whenever you do injection, divide the buttock into 4 quadrants, and you choose the outer upper quadrant. Lower inner quadrant is somewhere you don't want to mess with because we have the sciatic nerve. If we damage the sciatic nerve, it is going to be a big deal. And this is the upper outer quadrant. That's where we inject for the intramuscular injection in the gluteal region. And keep going. So this is full of everything. And this is nothing, just the bony skeleton left. And you can see the ilium, posterior superior iliac spine, posterior inferior iliac spine, ischial spine, ischial tuberosity, anterior superior iliac spine, anterior inferior iliac spine. And now I'm going to put the greater trochanter and lesser trochanter and ischial tuberosity. So you know this anatomy. You have seen this again and again, again and again. I hope I will be able to show you this anatomy again and again. So that's why, that's the only way we do remember in anatomy. And now if I put all the muscles back, now I can see the gluteus maximus muscle here, which is the most superficial or outermost muscle. And it is partly covering the gluteus medius muscle here. Now we can, if we remove the gluteus maximus, we can see the gluteus medius muscle here, which is originating on the outer surface of the ilium. Of course, inner surface of the ilium is covered with the iliacus. You have seen that. Now this is the gluteus medius. I am going to remove the gluteus medius, and now I can see the gluteus maximus muscle, minimus muscle here. And gluteus maximus, medius, and minimus, that is their job, and that is their nerve supply. Medius and minimus, superior gluteal nerve. Gluteus maximus is inferior gluteal nerve. The gluteus maximus is in the back, purely back of your hip, and therefore it will stretch, which is the extension of the hip. The gluteus medius and minimus muscle, they are more on the side of the muscle, and if they contract, they will abduct, pull the leg outwards. So that is the abduction. So gluteus maximus, medius, and minimus. And I want you to appreciate these little posterior muscles of the hip, which are piriformis, superior and inferior gemelli, and obturator internus, quadrangular muscle, which we call quadratus femoris. Quadratus femoris. You have seen the quadratus femoris. You have seen the quadratus lumborum in the lumbar region. And you saw in the wrist, you saw the pronator quadratus, little quadrangular muscle in the wrist here. So a few little quadrant muscles. So that is the cadaveric specimen. Now we can see bigger window and gluteus maximus, gluteus medius, and gluteus medius and gluteus minimus will be here underneath, and you can see the sciatic nerve. Sciatic nerve come underneath the muscle, which is called the piriformis muscle. Yeah, piriformis muscle, which we're going to attach to the greater trochanter. Now I show you the piriformis muscle, which will become a little nice and shiny tendon. It is so lovely, this piriformis tendon. It will go and attach to the tip of the greater trochanter. And the origin and insertion. So this is the piriformis muscle. So if I show you this diagram, and if the sciatic nerve is coming out, I want you to say this is the piriformis muscle. That is the really important landmark when we do the hip surgery. So this is the anterior aspect of the pelvis, ilium, superior pubic rami, inferior pubic rami, head of the femur, neck of the femur, and the greater trochanter, lesser trochanter, and the femur. So if we know that, we know this anatomy, and if we put the muscle on top, I want you to appreciate quadratus lumborum, psoas minor, psoas major, and this combination of psoas and the iliacus will become the iliopsoas tendon, which we go and attach to the lesser trochanter here. And this is the anterior superior iliac spine, and this muscle running across is called sartorius, and pectineus muscle here, adductor group of muscle here. So now we have three compartments in the thigh: the anterior and lateral compartment, which is made of quadriceps femoris, and the sartorius. Medial compartment or adductor compartment, which is made of adductor longus, adductor magnus, adductor brevis, which is underneath the pectineus, and the gracilis. And we have to appreciate this anatomy like anterior, lateral compartment, medial or adductor compartment, and the posterior compartment. That is the very good diagram. And this is the anterior and lateral, which is made of rectus, vastus, and the sartorius. Medial or adductor compartment, which is made of adductor longus, magnus, brevis, and gracilis, and posterior hamstring muscles, which are made of semitendinosus, semimembranosus, and biceps. So hamstring muscle, which is made of semimembranosus, semitendinosus, and biceps. Now you can appreciate. Membranosus, semimembranosus is the most medial. After that, we will have semitendinosus, and after that, we have bicep muscle. So this is their origin, which is hamstring, is the origin from the ischial tuberosity, which is here, and this is the ischial tuberosity, and this is where the hamstring muscle originate, which is made of biceps and semimembranosus and semitendinosus. If you look at the semimembranosus, it's most medial, semitendinosus is more lateral, but this is the bicep muscle, bicep femoris muscle. And of course, muscles in the posterior aspect of the thigh, they will cross the knee from the back and they will flex the knee. So this is adductor group. I believe you remember adductor longus, magnus, and brevis, which is covered under the pectineus muscle. And this is the biceps. This is the semimembranosus, which is more medial. And this bicep will go to the lateral, and semi-T and semi-M will go to the medial. And by doing so, we have the little diamond-shaped structure in the back, because on one side, on the lateral side, we have bicep. On the medial side, we have semimembranosus and semitendinosus. By division, we will have a little triangle which is what we call Popliteae fossa. All right, that's quite a bit of the names, which I hope you don't really mind. But we will just have to repeat again and again, and that's the only way we can remember in anatomy, because anatomy is the basic for the nursing, medicine, or especially surgery, physical therapy. So, and of course, radiology, anything related to radiology, you need to know the anatomy. So yes, I'm going to stop here. Has anyone got any question? All right, then. In that case, I'm going to stop here. And can everyone unmute and say goodbye to your colleague for the weekend?
Thank you.
Thank you, Alexandra.
Thank you.
Good day,
Goodbye.
guys. Okay,
Have a good weekend.
and you too.